Prescription for Mrs. Sonia Simons.
Yeah, that's me.
Mrs. Simons, have you taken this medication before?
No, I haven't. No, I haven't.
Okay, there's actually quite a bit of information I need to tell you before you can start taking it.
Okay.
So I'll just take you to a quieter spot so we can talk about it.
Okay, yeah, that sounds good.
This way. Now, Mrs. Simons, before I go further, I just want to make sure that this drug is suitable for you.
Okay.
The reason being, there are a lot of medications that do interact with the pill, and there are people with certain medical conditions that aren't suitable, that the pill isn't suitable for. So, do you have any, are you taking any other kind of medications, like complementary medicines or antibiotics, any kind of medications?
No.
Do you have any medical conditions, any, let's say, history of stroke or diabetes, high blood pressure? Do you?
Not that I'm aware of, no.
You don't suffer from migraines or anything like that?
No.
And do you smoke?
No, I don't smoke, no. I hate that smoke.
Well, that's good to hear. Now, here's your medication, Brenda. It contains cyproterone and ethanol estradiol. The names don't really matter, just thought I'd tell you.
Okay.
Has the doctor told you how, what you're taking the medication for?
Yeah, see, basically I didn't want to have kids, so that's what he told me what the medication was for. Also, he mentioned something about, because I also have excessive facial hair. Okay. He said that it would actually help with that.
Yeah, that's correct. That the medication can be used for those conditions. How it works is that the cyproterone content of the drug, it blocks certain hormones in your bodies, and those hormones are responsible for the excessive facial hair, so that will help with that.
Okay.
And at the same time, it changes your uterus temporarily, so it makes it hard for you to fall pregnant.
Okay.
And the other component, what that does is it switches off your ovaries basically, so you're very unlikely to fall pregnant while you're taking the medication.
Okay, that's good.
Yeah. Has your doctor told you how long you need to take it for?
Yeah, well, he said I could take it as long as I didn't want to have kids. So, which is a long time.
That's okay. Yeah. The only one thing I do want to point out is that with the excessive facial hair, that will take several months for you to see visible results. So don't panic if it's not working immediately. Just know that it will take time.
Okay. That's good to hear. As long as I don't fall pregnant, it's fine.
That's okay. Now, with this medication, how to take it is basically you just take one tablet a day, roughly the same time each day.
Okay.
Now, with most tablets, you're supposed to take it with at least 2/3 of a glass of water. The reason being, if you don't take enough water, the drug might get stuck in your throat, so just make sure you take at least 2/3 of a glass of water, and that will help flush it down.
Okay.
Now, here comes the tricky bit. As you can see here, there are 21 beige-coloured tablets, and there's 7 white tablets. Now, it's the beige-coloured tablets that actually have the drug in them. The white tablets, they don't have the drug at all.
Well, why do that? Why can't they just make 28 beige tablets?
Well, the idea is that you maintain a normal bleeding cycle. So after about 2 to 4 days of not taking the beige tablets, you will start bleeding a little, and that's just normal. And also, it's a good idea to just take tablets every day, so it reduces your chance of forgetting to take a tablet. So that's what they're there for.
Yes, I am quite forgetful sometimes.
Yeah.
That's true.
Now, what the company recommends is that you start taking the tablet on the first day of your period, and they recommend that you start in the red zone here. So
first day.
First day of your menstrual cycle. So if you let's say the first day happens to be a Monday. You see here there's the word Monday, or M-O-N.
Yes.
You start on that, and you follow the arrows through. So it's quite simple like that.
Okay. Yes.
Yep. But the thing I have to point out is that it takes seven consecutive days of taking these beige tablets before adequate contraception is effective.
7 consecutive.
Yeah. So after 7 days of taking these active tablets or these beige tablets, then contraception is going to be effective.
Okay. So what? You said 7 consecutive. So what happens if I miss one or something? I forget or something.
Well, if you forget and it's within 12 hours of when you're supposed to take it as soon as you remember. And you take the next dose at the normal time. So in that case, it's okay to take 2 active tablets in one day. and you're still going to be covered for contraception.
Okay, so what happens if it was like over 12 hours or whatever? Yeah,
if it is more than 12 hours, take it as soon as you remember.
Yeah.
But then, and take the next dose at the normal time. But then the problem is the chance of it being effective is lower. So what I would recommend is to just use other forms of contraception for 7 days. So like I said again, it takes 7 days for it to be effective. So if you forget for more than 12 hours, 7 7 consecutive days of taking the active tablet will do the job. But however, if you do happen to, within those 7 days, you do happen to get to your white inactive tablets, throw them out and start from your next pack from the active tablet and just follow according to that.
Okay, so just keep on taking the beige tablet.
Keep on taking the beige tablets if it happens to fall within that range.
I see. What happens if something goes wrong in between?
Well, if let's say, what you mean, the condom, if the condom breaks or something like that, along those lines. If anything like that, anything like that, come and see us as soon as you can. We've got something called the emergency contraceptive pill, and what that does is it works within 3 days. So come and see us within those 3 days, or otherwise it's not going to help.
Okay.
Yeah. Now, I don't want to scare you, but there are a few side effects. Just like any other drug, there are some possible side effects. And what I mean is, it doesn't happen to everyone. In fact, it doesn't happen to most people. But just want to make you aware of it. So if it does happen to you, you'll know what to do. Some common things are you might get some nausea, you might get some vomiting, mild headaches. You also might get a little bit of breast tenderness, and some people do experience a little bit of weight change. But like I said, it's not. It doesn't happen to everyone. Just want to make you aware. If you do feel nauseous, make sure you. Some people find that it helps if you take it with some food. So take some food with it. If you do vomit, and if it's within 3 to 4 hours of taking this medication, treat it as if you didn't take the pill. Treat it as a missed pill. So you just take it again.
So you want me to take another pill or something?
Yeah, so it's just like, just pretend that you've forgotten to take the pill. That's just how you should treat it. So take it as soon as you remember, and take it again at the normal time. If you do find that you keep throwing up the pill, come and see the doctor immediately. Because he can prescribe something else for you. Some people might also experience what's called breakthrough bleeding. It's just minor spotting of blood. That can occur, but that usually goes away within 3 months of taking the pill. Only problem is if you do happen to get a lot of bleeding, or if the bleeding lasts for more than 3 months, see your doctor immediately as soon as you can.
Oh wow! Well, this just
and there's also some other things some very important things to watch out for. If your headaches, like I said, you might get mild headaches, but if they get severe or if they're very prolonged. See your doctor immediately. If, let's say, you get any kind of chest pains that's radiating down to your arm, anything of that sort, see your doctor immediately, because that's not a good sign. And also another very rare thing that can happen is you might get some swelling in your facial regions. If that swelling is making it hard to breathe, go to the emergency ward, because that is serious. But like I said, it is very rare. Just want to make you aware of it. Other than that, there are a few things you should do on top of taking the pill. Just get your blood pressure checked regularly. So every time you come in for a refill for your repeat, just come in and we'll check your blood pressure free of charge. Also avoid excessive sun exposure. So use your SPF 30 sunscreen. Cover up, just a normal soft slap. And also see your doctor regularly because he wants to check whether you're to see how you're going and everything, and he might recommend you for regular pap smears and everything. So it's always good to see your doctor regularly, and also avoid smoking. But like you said, you don't like smoking anyway, so that's good. I know there is a lot of information to take in.
Is it okay to take like other stuff with this?
Like I said earlier, there are a lot of drugs that will interact with the pill. So whenever you're starting anything new, let's say you want to buy something like even from the herbal section, let the pharmacist know, and we'll make sure it doesn't happen to you.
Oh, okay.
There's no interactions. Yeah.
Yeah.
Yeah. So yeah, like I said, there is a lot to take in. So what the company that makes Brenda, what they've done is they've included what's called a consumer's medicines information.
Yeah.
And basically, it's just information on your drug, how to take it, what happens if you miss a pill, and just some side effects. So you can read that in your own time. And yep, that one I'll let you take with you. And also, what else I can give you is what's called a self-care card. So this one's on information on just the oral contraceptive, and there's some lifestyle advice as well. So those two, I'll give that to you. You hold on to that first.
Okay, thank you.
Yep. And other than that, just read it in your own time when you get a chance, and come back and see us regularly. Let us know how you're going.
Okay, thank you very much.
Thank you. Have a good day.